name is Dr. Max Greig. I'm an orthopedic surgeon in Puerto Vallarta, Mexico. I have been practicing orthopedics for the last 25 years. We take care of a lot of Canadians and Americans that come down here and get their hips or knees or shoulders and backs fixed. So today we're going to talk about the hips joint. So all joints have cartilage, and once the cartilage wears out, this is what happens. Normally cartilage looks like this, and then when it wears down, it starts to break down and eventually gets to be bone on bone. So what can we do for the hip? Well, the hip has a cup part that forms the acetabulum, and then we have the femoral head. So what we do in a hip replacement is we reassemble these parts. The cup goes into the pelvic bone, the insert goes in here, and this is the stem that goes into the femur with a ceramic head, and it gets connected so we can move around and do the things we love to do. We hope we can be of service to you. You take care.